I am thankful to be here with Catherine Dodd, who is an environmental health consultant. She's a registered nurse. Sorry, she's a registered nurse with a PhD in sociology. She is former district chief of staff for House Speaker Nancy Pelosi and deputy chief of staff for Health and Human Services to the San Francisco mayor at the time, who is now California Governor Newsom. She's former director of Region 9 of the U.S. Department of Health and Human Services in the Clinton administration, and is also on the National Committee to Preserve Social Security and Medicare now today. And I was thankful to have worked with Catherine on an important chapter regarding electromagnetic fields in nursing. And thank you so much for joining us today.
My pleasure, Theodora, and I'm thankful that you helped work on that chapter.
So tell me, you have been working in policy for years, and most recently put time and effort into the issue of electromagnetic fields. Can you talk about why you think this is important to the nursing profession and into health professions? And then we can talk about the chapter as well.
Nurses have always prided themselves in not just trying to treat the current illness, but in prevention as well. And we're just getting involved more in environmental health. We've always been involved in things like lead and air pollution and poison, but we're just now looking at what are the other environmental toxins and toxic things that patients are exposed to. And the whole issue of children and how children are exposed in the same levels as adults, but whatever the toxin is or the hazard is, because they're so small and because they have a faster respiratory rate and because they have more fluid in their body, and most important, their organs aren't developed, specifically in this case, their brain. They're like getting a much larger dose of whatever the poison is. So I'm working with a friend who does a lot of work on children's environmental health, and she wanted me to learn more about this, and I just kind of dove into it. And the work that the Environmental Health Trust has done, it's very accessible on exposures for children. By accessible, I mean it's not overly scientific. It's scientific, but the common person can understand it. And when you read it, you think, oh my God, is that happening to my children or my grandchildren or the kids in school? So that's kind of what jarred me into a deeper dive into electromagnetic fields and frequencies. And I was lucky enough to meet the leaders in the field, Deborah Davis and Theodora Scarato, and any number of others at a conference in California, I think 3 years ago, because it was before COVID, and just learned more and more, and then realized that in California, we had legislation that would have put antennas on every single publicly owned pole, whether it's a telephone pole or a light pole. Now in Los Angeles, they're looking at allowing individual people to put antennas on top of their homes, exposing their neighbors. And we've got several people where I live here in Sonoma County who have sensitivity to EMFs, and we've had to build special rooms in their homes so they can be protected. But I think what's important, I'll wind up this sentence, is that, because I started with the children, is that children we may not realize they're sensitive, except we have more kids with more maladies than we've ever had before. And the sensitivity increases, the DNA damage occurs, and the older they get, the sensitivity increases. So it's Nancy Pelosi always said, when you ask her what her 3 priorities are, she'd say the children, the children, the children. And if we look through the eyes of children, or we look through the lens of wanting to have a next generation healthy, well-educated, we need to focus on this, and we need to eliminate it before any more children or little adults are damaged.
Thank you. So tell me what do you think is important for elected officials to know? I know you've done a lot of educating. What is it that they really need to understand in terms of the bottom line on these issues related to children or 5G and cell phones, wireless, et cetera?
I think the most important thing is that we're not trying to do away with cell phones or computers or laptops. We're trying to make them safe. And again, I point to EHT's web pages on how to make your wireless devices safe. So you can use all the latest technology. And the best way to do that is with fiber optic cabling to and into the premises. Not just to the premises and then have it go to a wireless modem, but have it go into your computer. And what's amazing is it's much faster, hundreds of times faster. I live in a fire area, it's safer. So these are the things we tell the legislators. It's faster, it's safer for fire, it's safer for human health, it's safer. If we do it municipally or in a cooperative kind of way, we can control the cost and help people in low income or rural areas get access to it. There are just so many advantages. It has more cybersecurity, and the elected officials will say, well, it's too expensive. Well, in the infrastructure bill that was passed and signed into law by President Biden, there are billions of dollars, and his own advisory task force has recommended fiber over wireless, and local elected officials in particular who would be making the decisions about putting this in, they don't know that. So getting to them and letting them know we want fiber, we want wired to the premises, is probably the most important thing we tell them. And then we tell them, I was at a healers retreat this last weekend, and everyone had cell phones, and there were only 2 places on the campus where you could use them. And so I turned on the phone and I said, look, and I went to settings, I went to general, I went to legal and regulatory, and then I went to RF exposure, which is radio frequency exposure. And I said, this is where it tells you that it's exposing you to radio frequency radiation. And they're telling you not to keep it near your body. The reason it's under legal and regulatory is because if you should get cancer for holding it in your bra when you're not using it, or keeping it in your pocket, or even just holding it to your phone or leaving it close to you, if you get cancer, you can't sue them because they warned you. Why would that be there if it wasn't dangerous?
So how did they respond? And
well, they all say, the elected officials say, well, I didn't know that was there. I say, yeah, it's buried under settings, general, legal and regulatory, and RF exposure. Who knows what RF exposure means? It's buried there for a reason. And I think that creates just a moment of doubt, but they're also addicted. We're all addicted to our devices, and to looking things up instantly. Someone will say something about the polar ice caps, and someone will pull out their smartphone and look it up. We want that information instantly, and sometimes it's better just to say, well, if that's really important, I'll check into it later. But that makes them more amenable when they realize that they haven't really been, that the industry hasn't been straight with them. So I think that's how they respond. And then you try and get a little bit more in. And we haven't been terribly successful in our state legislature. The industry is the corporate, for-profit, greedy telecom industry has far more lobbyists than our you know, I don't know, 100 citizen lobbyists, and they are taking people to expensive dinners again now. And before they were just writing them checks, and it's like battling big oil or big pharma. They are as powerful as big oil and big pharma, if not more powerful, because they're big pharma is just in the United States. The telecom industry is international, and this is happening all over the world.
Right. And when local, when San Francisco and Berkeley tries to inform the people, the very simple, just one little nugget of this whole issue is that fine print warning in the cell phones. The wireless industry sues with their hyper aggressive legal action tactics to say that these communities can't even inform their public that that would be forcing them to say things that it's forced speech. I think that was one of their arguments, was that
Right.
it was forced speech on the part of the companies. So San Francisco and Berkeley couldn't even implement the cell phone right to know ordinance that they had passed. And in Maine, there was the Wireless Cell Phone Right to Know Act as well, which actually passed with one vote. And then when it went to the second vote, which is sort of routine there, the legislatures and elected officials switched their votes after, as I understand it, lobbyists were flown in for that time period, and then that didn't pass. So we're not even afforded that right to know about radiation, and it's really quite shocking.
And meanwhile, we're adding exposures in the form of Ring doorbells that have a wireless camera on them and that notify your cell phone wirelessly. Homes that the thermostat, you can turn it on and off from another country. If you're traveling, you can send a message to your home. There's any number, and I see kids playing with their mom's or dad's cell phone in the store, in church. I see, it's kind of like it's the new rattle or the new toy, and they're putting them in their mouths, and I have to hold myself back to not go up to mothers and say, that's really dangerous. I should carry a little card that says this is what you're doing to your child's brain. And I think the point I started with was that kids absorb more. The photos that are on the EHD website, kind of simulate that the radiation goes further into their brains, because their skulls are still soft until they're between 18 and 26. So we want to protect kids from concussions, young adults, boys playing football. We want to protect them from having concussions, but we're doing nothing to protect them from irradiating their brains. And the research on, the work you've done in cataloging all the research, over 2,000 peer-reviewed studies. You don't just get to publish something and have it peer-reviewed if there's no proof. So thousands of peer-reviewed studies that show cellular damage and brain damage and biological damage, not brain damage, but DNA damage, that it crosses the blood-brain barrier. It's kind of like when I say that, people don't know what it means, and I'll say, if they're adults, I'll say, have you ever had a really bad headache after you've had a few too many glasses of something, wine or beer? And they'll say, oh yeah, I've had hangovers. And you say, well, that's because the alcohol crosses the blood-brain barrier. So, and you can correct me, Theodore, but the EMFs create an opening in the blood-brain barrier. So any toxic that's circulating in your body, and there are thousands of toxic chemicals, including many, many pesticides circulating in your blood, all of those are exposed to your central nervous system. The research that Dr. Lai did on pregnant women, and not just the premature delivery and the small babies, but the offspring and the ADHD and diabetes, and we know this is dangerous, yet we're doing nothing about it. Much like we knew tobacco was dangerous long before we ever did anything about it.
The research from Kaiser Permanente that you're referring to is where they strapped a measuring device on pregnant women to measure the non-ionizing radiation, actually looking at magnetic fields, which are a component of radio frequency. And they found that the babies, well, first of all, they found increased miscarriages for the women, and that was a replicated study that they did. And then they found, as you said, higher symptoms of ADHD in some groups, as well as increased obesity and diabetes. And we have some videos of him presenting in a conference on our website where he talks about this research and what it does, in addition to many other studies that you mentioned, Dr. Henry Lai, and DNA damage as well. But that concept that non-ionizing radiation is benign, which is put forward that, well, it's non-ionizing, so it doesn't matter, it doesn't have an effect, is incorrect. It's outdated, it's antiquated. There was all of these studies showing an impact. What we don't have in this country is a process by which there can be a full systematic review and evaluation of the research by federal agencies, and then kind of looking at what's the correct policy in light of these studies, in these independent studies, which is really important, that the studies are done with independent funding and not industry tied scientists or with industry funding, because that's been shown to impact the results. So that's what we need. And I guess that brings me to what do you see as the big challenges that we need to overcome, or some of the myths that have been propagated that you are dealing with when you present this information to officials and in communities?
Well, I think your point about the independent studies is probably underscores the biggest problem, because, and as you said, it's been proven that the studies that have industry influence, or they have a scientist whose wife works for the industry, or they have a scientist who she or he themselves work for the industry, those studies are less likely to show harm. And then journals like the Journal of the American Medical Association or Scientific American, then respected journals will pick that up as a story, or even a review of the article and say, this is not true. Now, they're not picking up the thousands of other studies that are being done. And I'll just highlight Joel Moskowitz at UC Berkeley, who catalogs every single project that's done, research that's published. They're not picking those up. So you'll go into an elected official, and if they have a good staff person, the staff person will have done a quick review of what's out there on the issue and written a report. And the elected official will say, well, look, the Journal of the American Medical Association has just published this opinion, or just published this review, and they're saying that there's no problem. And so then going back to pulling out the research that says, look who did this research. They are influenced by the industry. Their research was funded by the industry. Now, more and more, if people read scientific journals, you have to list a disclaimer, or you have to list who funded your research. But who's going to take time to do that? And the Journal of the American Medical Association, people, stand up and say, wow, well, that the doctors know best. Well, I'm here to say the nurses know best. And we've just published a chapter in a textbook on environmental health that says electromagnetic radiation is dangerous. And it wouldn't have happened without you, Theodore, and your help writing it. I'm proud to be a co-author with you. And, I trust doctors, but, I actually trust nurses more. And we're raising the flag. We're saying, this is important. This is dangerous. You shouldn't do this. And I'll take it back to cigarettes. Yes, we put labels on cigarettes. We stopped selling them at age 21. Then we stopped selling them at age 18. But then electronic cigarettes came into being, and now we're trying to ban electronic cigarettes that are flavored like bubble gum and cherry. And so that adults don't want bubblegum flavored e-cigarettes. Kids want them, and that's why they do it. So we're still fighting big tobacco, and this has been over 50 years. How long will it take us to make our kids and ourselves safe from EMFs?
I think it can't wait. That's why we're in it to win it. We have to move this mountain, and I'm thankful to have worked with you on this chapter. I think it's a really important document. And so I put a link in the chat. There'll also be a link below when this is online. You can go, you can download the chapter for the Alliance of Nurses for Healthy Environments textbook of environmental health nursing edition. It's the second edition, and it really reviews the issue, kind of the basics of electromagnetic fields, and goes over both the science and also what nurses and health practitioners can do. I wonder if you could talk a little bit more about the chapter and pieces you wanted to pull out for people who are listening that you thought were really important.
I think the resources at the end of the chapter are very important. There are links to great other organizations and websites. And EHT, along with Grassroots Environmental Education, has done a Baby Safe project featuring well-known obstetrician gynecologists and pediatricians that tells you how to keep your baby safe. I think the fact that I think that just the mention of the ethics of the industry is important, and it makes reference to Harvard ethicists. Help me remember his name.
All right, you mean the textbook, the Harvard textbook by
yes.
Alster from
yes.
2015 on how the FCC is a captured agency, meaning that who they are supposed to be regulating is actually them. There's this revolving door between the industry and government back and forth. So you have the former head of the FCC that laid the groundwork for 5G being Tom Wheeler, former head lobbyist of the wireless industry in the United States before he was appointed as chief of the FCC. And then you have Ajit Pai, former Verizon lawyer, Brendan Carr, and it just goes on, back and forth. And we actually have a web page I'm going to put in the chat on the FCC commissioners and the regulatory capture and the revolving door. But go ahead, Catherine.
Well, and I thank you, because it just kind of went out of my brain. I just referred someone to it. I think it's a really easy read. It's a really scary read, but that it's the very issue we're dealing with. And a Harvard ethics professor wrote a very short book on it. Is significant, and why is no one paying attention to that? But that idea of the revolving door of industry lobbyists getting appointed to things is not unique to the FCC, and that corporate influence in Washington can't be underscored. So I would point people to that in the book, which is a very brief section. I think understanding what kind of exposures, there are a couple of great charts in terms of where you get exposed to electromagnetic radiation, and to lower level of just electric exposure. We're coming to
magnetic fields, the extremely low frequency field. Right. I'm really glad we covered that in there.
Yeah, so that, you know, whether you're talking about an electric blanket or you're talking about, I keep seeing these kids with drones, you know, and I'm thinking those are wireless toys that they're playing with. So it kind of goes through where you get exposed. It includes occupational for nurses and other health professions that work with different devices. And I think the other part is personal protection, that so many nurses, you know, have cell phones, and they'll keep them in their pocket. And again, as I mentioned, they keep them in their bra. And yet the phone itself says, keep this away from your body. But you have to find the small print somewhere on that phone. So I would refer people to those charts. And then I think the thing that we were very limited in our pages. And what I'd just like to point out is how stealth the industry has become in disguising their antennas. And we didn't put pictures of antennas in, and I mean, antennas can be very small. And now we are seeing huge towers go up with multiple antennas on them all the way around. Each one of those antennas is giving off radiation. Now, the level of safety that was set in 1996, over 25 years ago, for safety of radiation is no longer applicable today. And it doesn't take into account every single one of those antennas. So when you turn them all on, if that monopole of multiple antennas is anywhere near you, you're being zapped. So if I had anything, I would say, beware, and we would love to have signage. Most of the decisions now are made at the local level, so you don't just have to convince the elected officials in Washington or in the state legislature. You have to convince your planning commission. So I urge nurses and others and concerned people to find out who's on the planning commission and visit them with some of this information. Some local folks have been successful in implementing distance requirements, in implementing buffer zones from schools and hospitals and daycare centers. But it's a battle because all of a sudden, as Theodora said, they fly in lobbyists to lobby the planning commission and who are discounting the science. I mean, this is really a science issue. I'm thinking what other thing I would refer to in the book. So can you think of anything that like jumps out, Theodora?
Well, the resources, the summarizing of the science, kind of like the lay of the land, because I know when people learn about this, it's very confusing at first. There's a lot of rabbit holes that you can go down when it comes to electromagnetic fields. So I was just thankful to have this a nursing textbook that has like the basics. I mean, I'd say something. This isn't about no technology. It's about, like you said, safer technology. And a lot of the things you brought up, like the Ring doorbell or all of these internet connected things where you can be in another country and have this make a connection. A lot of them actually can really be done with Ethernet. So for example, having your thermostat on a timer, that's a very important thing, but it doesn't have to be wireless. I mean, I use my computer on a wired Ethernet. I have a lot of applications, like I text through my computer. So I don't use wireless right now. I'm on Zoom and I'm on an Ethernet connection. And in a similar way, you could, you could take a look at what's happening in your house when you're not at home via a wired, wired equipment. But I have to say, it's more and more challenging to find these sorts of non-wireless equipment, depending on whatever it is, be it your thermostat or the video camera, to get, I want a video camera that you can see what's going on, all of that. We really need the companies to bring this safer technology to market. And the only way to do that is to have the consumers and professionals and our medical community to be requesting it, to be saying, we want to have wired Ethernet technology. We want medical equipment that you can actually put on airplane mode. Like, it doesn't always have to be radiating. There are all kinds, as you know, of medical, heart monitors and so forth, where they're always transmitting, but those could be on airplane mode so that they are only downloading at certain times. I mean, that's something that the medical community has to work out as to what works best, but there's a lot of ways that we're just doing wireless everywhere all the time. It just all out, instead of like, let's think what works, where do we have efficacy data, what do we need? None of that is done. Instead, it's just if we can do it, let's do it, which makes no sense.
And two other things. The one, when you talked about devices, so I'm a type 2 diabetic, and the pharmacist just said to me, well, I'd really like to give you a Freedom device that you tape onto your arm, and then you take your cell phone and it reads your blood sugar. And I just said, first of all, I don't want to be emitting, I don't want to be emitting information from my arm. And second of all, I don't want to do that with a cell phone. But now it's becoming the state of how to monitor blood sugar. And I think, and that may be good and it may not. The other thing is seniors and kids too, baby monitors. I have an elderly friend whose daughter just put monitors in all over her house because she had fallen. New moms and new dads put baby monitors right within 5 or 10 feet of their babies, and those are radiating electromagnetic frequencies. And we just don't realize how much of it there is. And then I wanted to say one non-human related thing, long-term, but is climate change. And, everyone is worried about climate change. And the reality is when I talked about those towers with multiple antennas on them, every one of those antennas requires electricity. Whereas fiber to the premises requires little or no electricity. I mean, it's electricity that's carrying from area to area. I think, and the effect on birds and bees, and I do a lot of work in pesticides, and we see the bee population declining because of pesticides. Well, the bee population is also declining because the radiation confuses the queen, and they go into a kind of crazy dance, and you have pollinator collapse. Birds, migratory birds, rely on kind of normal magnetic frequencies to travel from one place to another and find their way back when they migrate. And radio frequency radiation interferes with that magnetic field that they rely on. At this retreat I was at, one of the leaders talked about taking your shoes off and getting in touch with the magnetic frequency of the earth. And the earth is at about 5 to 8 hertz. Well, you're carrying around 240 megahertz. Is that correct? Did I have that number right? In your pocket.
Oops, sorry. The phone has numerous antennas, which could be low band, mid band, and now high band with 5G, that are emitting a range of frequencies, actually, all of which are artificial and not natural to humans or to wildlife or to anything that's been on the earth before we started making equipment that emitted these unnatural frequencies. So,
and I want to make the distinction, because people say, well, we've had radio for over 100 years, and the retreat center that I was at is the first location that sent a radio wave across the Pacific. So and so when I talk about it, people say, well, what about ham radios, and what about just listening to the radio? That's a very long wave, whereas that has a long frequency, and frequencies are measured in waves. What we're talking about in terms of cell phones and laptops and smart devices are frequencies that are micro frequencies. They're microwaves, but they're not powerful enough to knock an ion off of a molecule, so that they're not like your microwave oven, but they're very close. And what's another thing you can do to be safe? And it makes me think of microwave ovens. You'll hear some spy movies, they'll talk about Faraday cages. And that's when they build a metal cage named after the scientist, around the room, so that no nothing can get in or get out. And that's what some cell phones there'll be cases that are like Faraday cages. Your microwave oven is like a Faraday cage. It's in metal so that those microwaves don't get out of it and affect you. Why would we build those if they were safe? You know, so it's really you just have to ask who's making money off of me. That's really what it comes down to.
Well, we always asking who is funding whatever the message is really important. And these days it's even harder to decipher that because we have university departments that are entirely funded by companies. So there will be professors and scientists with a university affiliation, and you have to do that next step and that next step to see who is funding that and what their credentials are as well, because we have a lot of non-biologically trained experts who are speaking on safety, but they're engineers or they are physicists rather than PhDs who have expertise in medical and biologically based science and so forth. But I think the most important thing is that there's been no full review. So you have these groups that say ICNIRP, that everything is fine, heating's the only harm. And then you have independent scientists calling for action, saying that there are adverse effects at levels well below FCC and ICNIRP limits. And we need to take action now because we'll never be able to take back that time that we are exposed or that our kids are exposed.
Right, and you'll never be able to take down antennas.
Very hard.
It's very hard to take down antennas. I just wanted to go back and say, Theodora, you mentioned ICNIRP. Will you explain what ICNIRP is? Sure.
So the International Commission for Non-Ionizing Radiation Protection, ICNIRP, it's a transnational entity that was started with scientists who got funding from the wireless industry to create it. It is an invite-only group. This is very important. And it's not like all scientists who have published in this field can enter into ICNIRP. They are an invite-only group of, I think, 12 to 14, no more than that, individuals. They have a great name. My cousin, who's a businessman, a really good one actually, said it's all about the name. If you have a name that makes you seem like you've been around forever and you know what you're doing, people are going to go with you. In fact, he started a company that with a great name based on that premise. And in International Commission for Non-Ionizing Radiation Protection is a great name. So people think that, well, they're the authority, but we need to look at who they are. Right now, we have several commissioners with a long history of industry ties, and yet they say they get no industry money because ICNIRP at this time does not get industry money, except the individuals and the science that they review have those long-standing history of industry ties. And what they say is that heating's the only harm, and the studies that show effects, they critique, dismiss, don't include, or come up with all kinds of reasons as to why it's not applicable to their finding that there is an effect. Actually, what they base their limits on, they list a handful of studies. These are small animal studies. It's less than 20 animals in these few studies that they have as the basis of their decision that heating is the only harm. And these are antiquated studies, where they took animals, small animals, rabbits and mice, some really small monkeys and rats, and they heated them up and put a rectal thermometer, and they starved them before the study, the experiment. So when they stopped pressing the lever for food, they decided, the scientists at the time, the engineers at the time decided that's the level that we have harm. These little animals that were starved in the 70s and 80s, again, under 20 animals, when they stopped pressing that lever for food, that's too hot. their internal body, it got too hot. So that's what we're putting as the threshold of behavioral disruption. And then they did a rather arbitrary decision on knocking it down, which we wouldn't use that kind of analysis today for a threshold like a safety margin, for example. And that's what our limits are based on. And even the National Toxicology Program study that is an animal study, they say, well, it's an animal study, so it doesn't apply to humans. And they dismiss and critique that study. And I will say for everyone on the call, if you want to put in your questions in the chat, I'll ask them. I've sort of been integrating some of them into our conversation, but.
Well, I think I just wanted to add on the National Toxicology Program. That is the only research that the United States has done since the Second World War, when there was research done that showed that soldiers were affected by EMFs that they were exposed to. But the NTP study under the National Institutes of Environmental Health Science, under the NIH, was a $30 million study. It was done over more than a decade, and they used thousands of mice and rats and exposed them to what we would call 3G or third generation. People get confused by the G. Now that we have 5G, they think that's 5 gigahertz. It's not. It's fifth generation. We're at our fifth level, our fifth generation of cellular technology or wireless technology. They exposed them to our old flip phones and showed that in fact there was DNA damage, that they caused schwannomas on the hearts of the male rats, which, you know, it could be similar to the fact that we're seeing more heart disease in men than in women who carry their phones in their pocket. That's not scientific, but I'm just saying it's an exposure example. And they found glial cells, which we know cause glioblastomas or are linked to glioblastomas. So our own United States research that was done in a highly scientific way, you know, underground in a sealed laboratory, highly controlled, showed damage. And what happened to the results of that? They got squelched. They came out and they just, no one, you know, there was no news about it. It was, so that was $30+ million down the drain, and a lot of work down the drain. And the study was done at the request of the EPA, and the EPA gave the FDA, sorry, and the FDA gave the money to study it. And when they got the results back, they were like, oh, well, you know, these are positive results of damage. So, and then you compare that to the ICNIRP research, which wasn't done scientifically, and everyone's quoting ICNIRP, whereas the WHO has said since 2011 that wireless radiation is a possible carcinogen. So it's there's so much research that says beware, you know, be careful, study this more, or take action now. And there's so little. We have the wrong name. We shouldn't have called it the National Toxicology Program. We should have called it the National Death Program or something. As you point out, that titles make a difference. But anyway.
Well, the National Toxicology Program is our flagship. It's considered around the world to be one of the most highly respected institutions that does animal testing and toxicology testing. It was shocking when the FDA dismissed and said they didn't agree with the findings of the NTP. And remember, the NTP study, that was peer reviewed with many panels of review. And when they had their final peer review, and I was there in North Carolina, and when they had the 3-day unprecedented peer review, the peer reviewers actually elevated the conclusions to clear evidence of cancer, of a carcinogenic activity, meaning the exposure, or they call it the treatment, actually caused the tumors in the heart. So that, because they looked at the dose response, they looked at all the aspects and the statistics of that, and there of course were other other aspects to that study, DNA damage that was found in groups of both rats and mice. And that DNA damage was not found after 2 years. That was found after just a few months, depending on which animal we looked at. I think it was 14 to 19 weeks. They then took a little subset of animals out and they looked for DNA damage and found it. And this is throws everything on its head. This assumption that heating is the only harm. It means that at non-thermal levels, there are adverse effects that have been documented. There was also damage to the heart, to a ventricle of the heart that was found, as well as other elevated kinds of cancers. And it didn't give the all clear. I think Dr. Melnick always says, if it gotten the all clear, there hadn't been any effect at all. We could have been like, that was a well done study and there was no effects. This brings a lot of information to that question of safety, but it wasn't the all clear.
Dr. Melnick was in charge of the study, just to,
yeah,
and has since retired and spoken out on this issue.
Yes,
and I was just going to say, he led the design, and the study itself has been replicated in Italy by their version of the NIH, the Ramazzini Institute. So we proved it, they proved it, and they proved it at further distances away.
Lower levels, much
lower levels
to replicate cell tower base station exposure, and they found the same tumors.
It's hard to refute, and it goes back to when Theodora keeps saying heating, it goes back to that warning that's in the cell phone that says this cell phone meets the SAR, which stands for specific absorption rate, standard of 1.6 centimeters.
Watts per kilogram.
Watts per kilogram, thank you. And that's measuring something in the head of a dummy that's filled with a gelatinous material that's supposed to mimic your brain. And there's, a cell phone outside of it. Well, and how long does it take, or how much does it take? How much radiation does it take to increase the temperature of the center of that dummy? It's appropriately named mannequin, actually. And that's what we're basing our safety on, is a mannequin filled with jelly. And it was a standard set in 1996. So the Environmental Health Trust was very successful in a lawsuit against the FDA, and appealed it, and they were actually the FCC was remanded to re-look at the dangers, and have done nothing. And I can't say enough about how humbled I am to work with the Environmental Health Trust, because they work on all levels, on the local level, on the international level, state level, federal level, and the scientific level. And it's not just, so they know the science, and they do things like this to educate people. They help write chapters in textbooks for nurses, and hopefully I've actually referred a lot of people to the text, because, as you said, it is a kind of 101. It's the basics, and then you can learn more. And once you start learning more, you just get more and more overwhelmed.
So and our time is winding down, and thank you so much for joining us. But tell us what what would you like to tell people that they can do? Maybe they're hearing this and they're nurses, or they're in the health profession. What do you recommend for them as their next steps?
I think the first thing is to protect yourself. As you point out, if we all would demand that our computers and laptops and devices had the US, not the USB connection, but had the connection that you stick into your wall, your Ethernet. Thank you. If we demanded that, they would make more. They'd stop creating devices that don't have that, but you can get adapters for that. So I would say that. I would say If you have a cell phone, keep it on airplane mode unless you need, you're anticipating a call from a employer or a child or someone who's in your care. And then when you have time to look at your messages or make phone calls, sit down and keep it, 18 inches away from you, or use a headset and take it off airplane mode and look at all the messages you got. I would say don't keep it in your bedroom. Turn off your modem at night if you can, and keep devices away from small children and children in general. Make sure your young girls aren't putting them in their bra to hold them, or women. I was with a woman this weekend who was very well developed, and she would pull her cell phone out of her bra, and I'd say, "Oh, please don't do that." It's hard to keep me from commenting on it. And then I would find out where the cell towers are in your neighborhood, and do you have a choice? The other thing we didn't talk about were smart meters. In my neighborhood, when I lived in San Francisco, everyone ended up with a smart meter. You didn't have a choice, and we had to fight to get to get an opt-out. So you'd have apartment buildings where there'd be a panel of 20, 30 smart meters on one wall. So the person whose bedroom was on the other side of that wall was getting irradiated, and many people noticed it. So do you have smart meters for electricity, for water? And if you do, try and get an opt-out, and states have done that. There are resources on that. I would tell people to get to know your local legislators. Who are the supervisors that appoint the planning commission? Who are your state legislators? And where is there a safe tech organization near you? There are a lot of safe tech organizations. The Americans for Responsible Technology, ART, has a list of organizations throughout the country, and get on their mailing list and find out what's happening. What would you tell people, Theodora?
Well, I would add to what you're saying, which is right there. What I would tell people is also, if you're part of a organization, to bring this issue up, because it's one of those situations that affects almost every organization we're a part of. Maybe it's a homeowners association where you talk about, do we have a wireless ordinance? Could we make a stronger wireless ordinance? Or maybe you're a part of, like, I'm a social worker, the National Association of Social Workers, or if you're a nurse, those national organizations, or at the state level, they need to hear from you about this issue, because there really needs to be resolutions and a full and frank discussion in these various circles about this. It does have implications if we don't act, if we don't start educating people on how to reduce exposure, educating policymakers on that this is a thing, because most don't even know what, I bring this up to some elected officials and they're like, I don't know much about that, but they need to know, because they're making decisions that have to do with it, like allowing allocating millions of dollars to wireless devices in classrooms without allocating money towards Ethernet connections, or ensuring that the computer hardware, the hardware and software they get can be on airplane mode, that you can work offline. I mean, there's so many simple things that can be done so that you can still be connected. You can be connected to the ones you love, to your workplace, in your community, but you don't have to always do it wireless all the time. So I think
let me just add one thing, and that is that think about symptoms. When you said social workers, I think of kids with ADHD. Right. We've never figured out why kids have ADHD. Well, maybe it's because they're surrounded by something that previously we haven't been surrounded by. People now are exposed from fetus to old age to electromagnetic frequencies in greater and greater numbers. And they'll say, well, prove it. Well, it's hard to separate out the chemicals from the electromagnetic frequencies. I say we are filled with over 70,000 chemicals that are synthetic chemicals in our blood and in our body tissue. And then we heat them up, metaphorically, with wireless radiation. And you can't just single out one thing. And what we need to do is go back to living safely and living simply. take those devices away from the kids.
You're bringing up a key issue, which is that, like, clinically, at the doctor's office just last month, my daughter was getting a physical, and she asked, the pediatrician said, "How long are you on screens?" So that was a great start. I was like, well, what do you know? This is new. I've never had any doctor ask that question. But what she didn't ask was, how are you using the screens? Well, are they wireless or not? Because we're not there yet. We need to get there, because the American Academy of Pediatrics has recommended reducing exposure, but that needs to be incorporated into our practice, because there is science showing increased oxidative stress and in the brain from wireless exposure. So if we can decrease our exposure to wireless as well as toxic chemicals, you can help your body to be more resilient. And all of this needs to be incorporated into practice. And then there's the issue of headaches, say, kids coming in with a lot of headaches.
Insomnia.
Insomnia.
How many people are having trouble sleeping?
So
No.
I'll tell you, my husband was the one thing early on this issue. He was kind of very skeptical and just wasn't following me, right? And when I finally turned the wireless off and changed the connections in the house, he goes, tell you what, I am sleeping better. I did notice that, Theodora. And I'm like, oh, it was a bit of a lift to get some of those things done, but he noticed that, and all that overstimulation in our body is having an effect. I mean, it is not healthy to always be surrounded in wireless all the time. And one takeaway, getting your bedroom, like if you're listening to this and you're new to the issue, cleaning out the bedroom is a really good start. Not having, like, at night, turn wireless devices off, get those electronics out of the bedroom. Don't sleep with your cell phone, like you said. That gives you that 8 hours of low EMF time so your body can heal and repair. And it's easy. It's really easy to turn things off when they're not in use. And then the next step is to take that further step. When that's where we need corporate companies to really help, because I have spent more hours than I even want to say helping my mom deal with her wireless router, because it was not so easy to just make it Ethernet connected. There was so much I had to do, and we really shouldn't have to do all that. We shouldn't have to be the FBI to solve our problem. It should be like, we go out, we buy it, it's done. Plug and play for safer non-wireless devices. That's my dream.
Theodora, thank you for having me. This has been, I hope people are watching, listening, and checking out the chapter in the textbook and checking out the EHT website. It's the go-to place for information. It's an amazing organization, and the devotion of you and Deborah and the other staff is laudable and will make a difference. You are our Rachel Carson.
Well, thank you so much. Thanks to all for joining us and for your support of Environmental Health Trust.